today's students on their way to becoming the parents, teachers, and leaders of tomorrow. While facing the challenges of learning and growing, many school-aged children also face dangers stemming from a wide variety of health issues. These health hazards range from poor nutrition and lack of immunizations to substance abuse, unplanned pregnancy, violence, and suicide. Adolescence is a risky time for many students, and making good choices in an ever-changing world can be especially difficult for some. By the age of 15, 25% of all adolescents are involved with behaviors like smoking, substance abuse, or unprotected sex, putting them at risk for serious health problems. In an effort to meet the diverse health needs of both children and adolescents, school-based health centers have been developed by parents, educators, community leaders, and healthcare professionals in schools throughout Oregon. Routinely staffed by an office assistant and a nurse or nurse practitioner, the school-based health centers provide an easy, accessible healthcare facility located inside school.
Okay.
Here, students can receive medical attention, health promotion counseling, referrals, or in some centers, consult with mental health professionals for assessment, education, or other care services.
Yeah, our main emphasis in Philomath is on our elementary school here, which is kindergarten through 4th grade, although we do go into the middle school and high school. We serve between 20 and 30 students a day and average about 350 students a month here at the Philomath School-Based Health Center.
They are available to students by appointment. The regular referring a student by a teacher during the school day happens with the school nurse. We still have school nurses in the building, and they collaborate with the health clinic. But for the most part, it's like having a medical office or a clinic on your school site. It's very much bringing the community into the school.
School-based health centers are not a new idea. They have been in place around the country since the 1970s and in Oregon since 1986. There are currently 29 centers in the state in 13 counties, serving urban and rural schools from elementary to high school age students, and the need is growing.
And now I'm just moving across your abdomen. Okay, this is where you had the inguinal surgery on this side. Okay, any tenderness or swelling there at all?
We teach them how to learn to talk with a healthcare provider. It's interesting enough to know as a lot of them will not tell you all of the information because you forget to ask. And that's where I think we come in. We sort of specialize in adolescent medicine. We know that that's going to happen, so we ask lots and lots of questions.
National figures show that about 1/2 of all students who use school-based health centers may have no other access for health care. In fact, 1 in 5 youth today have at least one serious health problem, and school-based health centers may be their only source for detection, diagnosis, treatment, or referral.
Adolescence is probably one of the most critical times in a person's health, when it is essential that they have options for making good choices for their health. It's one of those critical crossroads. It's the time when they take the risk. They take the risk to try something new, and what we hope is that those new things they try will result in healthy, happy, productive adults. And offering them options for good health care that's meaningful and relevant at the critical times, I think, is absolutely essential.
Good afternoon, George School-Based Health Center. This is Mark. How can I help you?
Serving a variety of student and family needs, staff and equipment are usually funded by county health services dollars, health-related grant funds from the Oregon Health Division, or a combination of federal, state, and local monies. Facility space is provided by the local school being served.
They've saved us a lot of grief, so we've had a great experience of having the center here. We're getting a lot of care that we couldn't otherwise afford anyway.
Every kid has the right, to see a doctor and get whatever's wrong with them, fixed or cured or diagnosed before maybe it's too late. Health center services have been very beneficial for me just because while I'm here at school I can just stop in and get whatever it is checked out without, wasting a lot of time. I'm in and out in like 20 minutes and all fixed up.
School-based health center staff provide acute care for injuries and illness, make sports physicals available to the general student population, and work with those suffering from chronic ailments such as asthma. They actively engage in health promotion and prevention. They educate and inform on issues from infant well-being to reproductive health issues, along with treating the physical ailments most commonly associated with school-based health centers. Some health centers even have staff trained to deal with mental and emotional health issues as well.
Any type of feeling that an adult is experiencing in their life about any situation, a child can be experiencing that too. For example, depression, dealing with death and dying, divorce. Children feel all those feelings that adults may go through.
Only when students use the centers can they learn even more than taught in the classroom about making good choices and managing their own health care. Ease of access for students, guaranteed confidentiality, a caring staff, and supportive principal are all keys to success in students using school-based health centers.
Because we're accessible, they don't have to miss class or, like get out of school, and a lot of them don't have insurance. They can't receive services anywhere else. We have a very low-income population, a lot of transient people in the community. There's also quite a few low-income people, as well as people that do have insurance, and they just feel comfortable coming here, and we take one and all. So it's, I think they feel that their needs are being met, and it's a place for them to come and talk.
I think the most important thing about the health clinic is that if they're always here for you if you need anything, and everything's confidential, so you can always feel that whatever you tell them is not going to get told to somebody else, and so they're just always here for you, no matter what.
The medical and mental health staff of school-based health centers work to provide needed health services to students and their families. They also work to have these services reflect the needs and mores of the local community. Each school-based health center has an advisory board to help develop and review policies dealing with services offered. The board is an invaluable asset to staff in determining health needs of the community and in setting community guidelines for both health education and services, especially in areas of reproductive health.
In the beginning, we met basically monthly. We began to set up policies. Of course, there was a time for the staff to report what type of health concerns they were seeing in the clinic. One of the first things we did was to develop a birth control methods brochure that stressed the various methods, stressed abstinence, because as a district we wanted to make sure our students understood that we felt like that was their best choice. But for those that didn't make that choice, what the other methods were, how safe they were. So that became a major project that we worked on.
I feel that the health services are definitely community-based, definitely community interest. They want community input, they want parental involvement, and they care about what happens to our kids.
Involvement of staff, parents, and community, as well as offering a broad range of easily accessible medical services, are vital to the success of school-based health centers. Once people use school-based health centers and become involved, they find that common misconceptions about the centers are unfounded.
I think most parents are concerned, especially they think we're going to be treating their child without their permission. And that's the one thing we always call the parents. Whenever we see their children, if we need to treat them, we call home and get the parents' permission, and don't give out any medications without the parents' permission. And we try to keep the parents informed of everything we're doing, so they're included. And if the children that we see have providers already, we try to refer them back to their own private doctors. And generally, most parents that I've talked to are real happy we're here.
School-based health centers not only help children and their families, but they also help teachers and administrators.
The school-based health clinic has been here almost a year and a half, and really difficult for me to imagine how we ever managed without having them here. To have a full-time health facility available in a school composed of at-risk students, over half of which have no medical insurance and no health care provider. It's a tremendous resource, and we really feel that we've added 4 more professionals to our staff, and so it's really hard to imagine that this health clinic is really actually funded by Multnomah County because we feel like it's ours.
A major factor in the success of school-based health centers is simply their proximity to students. They are located on campus to facilitate use, and students do use them.
Just a screening to see if we need to send you for another assessment.
Access is a big deal for teenagers. Most of them, if something's bothering them this moment, the next moment it may not be. So if you're not right here visible and accessible to them, then they may forget that they had a sore throat early this morning. And that can actually prove to be pretty harmful later on in life if they have a damaged heart valve, for example. If a bacterial sore throat goes untreated and it affects the heart muscle. So there are some pretty serious consequences for students if they don't get the proper care. It's one of those things, out of sight, out of mind. And if you're not there on the spot, sometimes they forget.
There is a definite need for school-based health centers. In Oregon, 61% of all students who have a school-based health center in their school make use of it, and nearly a third of teens who use school-based health centers may not have access to other suitable health care. Along with quality and convenience, the health centers also provide a continuity of care that may not always be available from a traditional medical office. At the centers, healthcare providers are able to get to know their clients and track them through their school years. This is especially important when dealing with adolescents who may need follow-up treatments.
Hepatitis B vaccine is somewhat unique in that in order to receive the full immunity from the vaccine, it requires a series of 3 injections over approximately a 6-month period of time.
Adolescents, as a group, tend to ignore their need for health services, and students with the most need, those who tend to engage in high-risk behaviors like smoking, drinking, using drugs, having sex, or attempting to hurt themselves, are seen in school-based health centers in higher proportions than other students in their school. This provides health center staff an opportunity to offer health education and guidance to students who are in the most need.
1 out of 5 youths have a health-related problem, and health-related problems do affect school attendance and learning. So if we can provide school-based health centers that are easily accessible and available in a trusting and caring manner, I think we can have a profound effect on a student's life and their ability to achieve their goals.
And it's an opportunity for them to get reliable information from somebody who they know cares. The way we've designed our system is that they get a chance to get to know you, so there is a trusting relationship. And from that, they just continue to grow. And it's really nice to be able to see them become healthy adults and making really positive choices about their health care in the long run. And I know deep down in my heart that a lot of them get that information, and it starts here.